Welcome everyone to clinical demonstrations video for complete dentures making. This is part 2 of this video series, primary impression making. First, you have to prepare the following dental materials and instruments. Impression compound is selected for this procedure. These are rigid metallic stock trays. They come in different sizes and can be perforated or non-perforated tray. First of all, select the tray that suits the size of the arch. Try the tray first to see if they fit the arch. Insert the tray on one side first, then the other. This is to prevent stretching of the cheeks. The tray must not impinge on the soft tissues, and the handle of the tray must not impinge the lip. Ensure that the distal portions of the tray extends to the posterior landmarks, such as tuberosities and the retromolar pads. Width of the tray should extend about 5 mm beyond the external surface of the residual ridge. Set your water bath to 55 to 60 degrees Celsius. Immerse the compound disc completely in the water bath. Remember to place gauze or towel at the bottom to prevent adherence to the water bath wall. Wait until the impression compound is completely softened. The material is kneaded and made into shapes according to the tray. For the mandible, it should be sausage shaped, and for the maxilla, it should be ball shaped. The softened impression is then loaded onto the stock tray. Make sure the material covers the entire tray until the border. This is an example showing the coverage of the impressions after loaded on the trays and before making impressions in the patient's mouth. When making mandibular impressions, the clinician should stand to one side in front of the patient. Insert the tray on one side first, then the other. This is to prevent stretching of the cheeks. Patient is instructed to raise the tongue while the impression is being seated centeredly over the residual ridges. Once seated, the soft tissues surrounding the vestibular borders should be manipulated to minimize the overextensions of the impressions. The tray is then stabilized with your fingers with minimal pressure and secure in positions until the impression materials has set. At the meantime, patients should curve the tongue to move to the right and the left to get the shape of the lingual sulcus. It is important to maintain the positions of the impression tray to prevent it from dislodging vertically away from the ridge and distorting the impressions. For maxillary impression, the clinician should be positioned to one side and behind the patients. Material is loaded onto the tray, covering the entire area, including the border. This is an example showing the coverage of the impressions after loaded onto the tray and before making impressions in the patient's mouth. When making the impressions, the upper lip is everted, and the tray is seated from the posterior to the anterior, so that the material flows towards the anterior rather towards the posterior. The tray is positioned by noting the locations of the handle in relation to the facial midline. Once seated, instruct the patient to be in relaxed positions and control his breathing through the nose. The soft tissue surrounding the vestibular borders should be manipulated to minimize overextensions of the impressions. The tray is then held firmly with minimal pressure and secure in positions until the impressions materials has set. If your compound impressions did not attend adequately until the undercut area, you need to do an alginate wash on the compound impressions. Rinse the impressions under running water. Immerse the impressions fully in the disinfectant solutions for 10 minutes. Then rinse again and place it in a sealed bag before sending it to the lab.